But before I do that, I would like us to, sorry, okay, here we go. Before I do that, just to make sure that we're all on the same page in terms of what psychological first aid is, I'd like to start with a small self-reflective exercise. So after I've given the instruction, I'll just give you about 30 seconds. What I'd like you to do is to remember a time in your life where you were in distress, but where somebody helped you. So I don't want you to focus on the experience or the event that led to the distress, but I'd like you to focus on the help that someone gave you. And just think for these 30 seconds about what was it about the person's actions or about their behavior or even their attitude that was helpful to you in the moment that you felt distress. And you could just, when you've thought of these things, if you can write your responses in the chat, and then I'll ask Anouk to read a few of those responses.
Yes, I'm just waiting for questions to be, or for comments to be put in the comment box.
So if you could share what it was when somebody helped you, what was it about the help they gave you or about their behavior, their actions that was helpful in that situation?
Eric is sharing.
We have Eric.
Oh, sorry, Basili, you go ahead.
Yeah, we have Eric Kimboy sharing that kind and empathetic, they listened, they were calm.
Mm-hmm.
Then Abina saying that understanding and empathy. We have Miriam, Dr. Miriam, the person listened and showed empathy.
Mm-hmm.
Then we have Fatima saying that showing of their presence.
Okay, super.
Yeah, that's it for now.
Okay.
We have
Okay.
another one, from Rosemary saying, when I lost my mom and I was all lost, but my friend was there for me full time, Chili buried her.
Okay, thank you very much for sharing. The reason I wanted to do that was because most of us, probably all of us, have actually received psychological first aid at some point, or we have given psychological first aid to someone else. We just perhaps didn't really know that that is what it was called. So a very simple definition of psychological first aid is that it's both a set of skills and knowledge that can be used to help people who are in distress, and it's a way of helping people to feel calm and able to cope in a difficult situation. So that's a very simple definition of what it is. The materials that I'm going to introduce to you are based on this set of materials that you see WHO and World Vision, and the materials on PFA for children were based on original materials that were developed by Save the Children. The recent materials that we've developed now are also, of course, based on the most recent recommendations and guidance from WHO, from the Interagency Steering Committee, and from the Peer Center, and other actors also. So we've been trying to keep up to date with all the recommendations in MHPSS. So what we've done is we've developed a basic training on psychological first aid, which we recommend that anyone who's going to take part in these trainings does this basic training. After that, they can take part in any of the 4 shorter additional training modules. One of them is on remote supportive communication. Another one is on caring for staff and volunteers remotely. The third is on PFA for children. And then the fourth one is on loss and grief. As Anouk mentioned earlier in the introduction, these were developed for Red Cross and Red Crescent national societies, but they're very easy for any of you working in any organization to pick up and adapt and use yourselves. So we've developed them as simply as we could so that they're very easy to use. And at the moment, these are the two main training methods that you can use if you want to use them. One is you can conduct the training in an online live training in a similar platform as the one we're using today, Zoom or Microsoft Teams. Or you could make a recording of the training so that you can, what we've done is we've put the recordings on YouTube. That means that people who are unable to access on live internet, and for example, I live in Eswatini in Southern Africa, and here many people wouldn't have the internet access to join an online training. So they can go and watch the training on a YouTube, and then they can do it on their own. Both of the trainings are based on a set of PowerPoint slides. The online live training has speaker notes that give very clear instructions to the facilitator, both in terms of how to manage groups and how to manage the group activities, but also what they should say. The online live training obviously is interactive. It includes a series of activities. Some are plenary for big groups, others are for small groups. If you're able to use, for example, in Zoom, you can use breakaway rooms and put all participants in pairs or in groups of 3 or 4 so that they can discuss things during the training. Both the trainings also have a worksheet that the participant completes while they're going through the training. And we also use demonstration videos. And I'll show you one a little bit later that demonstrate PFA skills, because that really is what we would do in a live training. And then of course for the online training, if it's possible, then you could also ask participants to take part in role plays, which you of course can't do with the solo version. So here's an example of one of the activities in the training in the online version, where the participants are in groups and they are asked to discuss and list key groups of people that are affected and more at risk during the COVID crisis. And here's a same activity, but in the recorded version, where the participant instead is asked to pause the video and list groups of people that are affected and more at risk. So that just shows the two very simple changes that are made to make it either online or recorded. I'll tell you a little bit more about the basic PFA training, the core training, the content of it. First, it explores what psychological first aid is. Then it looks at what is the impact of COVID, and you can tailor that so that it focuses only on your context, or of course multiple contexts if you're a bigger group. Then it looks, the training also invites participants to explore what reactions we can expect people to have. And then of course most of the training is focusing on how to help. And I'll talk a little more about that. And the training ends with focus on self-care. So in terms of how to help, of course, we know that many people are still working face-to-face, but during this COVID crisis, we also have had to adapt our helping methods. So we have looked specifically on how to provide help remotely. So for example, over phone calls or video calls, or even how you can just support a person through SMS or WhatsApp. Or other message apps. So as I said, we have based the training on the action principles introduced by WHO, look, listen, and link. And the reason we've done that is because they are really easy to remember, and we feel also that they really encompass all the key actions that should be included in psychological first aid. For those of you who are not familiar with it, I'm just going to run through these very quickly. This is an example of the actions that are involved in the action principle of look, where a helper needs to collect information on what has happened, what is happening. The helper needs to find out who needs help, look at safety and security risks, to explore if the person they're helping has any physical injuries, attend to immediate, basic, and practical needs, and also to identify emotional reactions. So these are the core actions that are involved in Look that we generally train people on in PFA. Now with the COVID crisis, in the training, participants are asked to think specifically about what we're facing right now and perhaps how we need to adjust these looked actions to respond in the COVID response. And I've just added one example here is around safety and security. That consideration, of course, is that now we have to think about infection risks, which means that we have physical distancing, and that we have to think also when we send helpers out or we interact with others that we need to make sure they have the appropriate PPE. In the Look section, participants also learn to identify common reactions and I hear a lot of background noise. Can I ask people please to mute if they're please mute your microphone. Thank you. Participants also are they learn to identify severe reactions that someone may be having so that they also know when to make referrals. Right, so now I'm going to show you just quickly a 2-minute video clip so you can just see how the videos are used. This is a video that I made here in Eswatini, but what we are encouraging is that if anyone picks up these materials, that they create their own little videos that are relevant to the context that you're working in, and of course also in local language. Right, so I'll just find the video clip and show that to you. And Nook, if you can tell me just when I started whether you are all able to hear it properly.
Yes, I will.
That would be helpful. Hi, my name is Pernille Hansen. I'm a psychologist. I'm volunteering here at the National Helpline. What's your name and why are you calling today?
Oh, okay, good. Yeah, my name is Nozipo. Yeah, I saw your link on a notice board at a hospital I was at recently, and I'm calling because I feel like I'm just going crazy and I'm losing my mind. There's so much going on, and I just need help on how to cope right now. And I thought maybe I could reach out to you, that maybe you could help me.
Okay, thanks Nozipo. Thanks for calling us today. I've got about 15 minutes that we can talk in, and in those 15 minutes, I'd like to hear more about the challenges that you're facing, and then we can try and see what ways you can possibly look at trying to address them. Do you want to tell me a bit more about what's going on, Nozipo?
Yeah, thank you. Thank you so much. Yeah, I feel like I'm going crazy right now. So much going on. Obviously, I'm sure you're aware of the coronavirus, and it's just, I don't know how to live with it. It's been something that's been running, through my mind every single day, every night. I can't sleep because I'm worried about my family and how we're going to cope. I'm worried about my children getting sick or my husband getting sick and not being able to look after them, or vice versa. I'm worried about my job. I'm worried about I'll make ends meet if, it comes to us losing work and not being able to have an income in the coming months. I'm just dealing with a lot right now. I'm afraid to go outside. I'm afraid to leave the house.
Nozipo, I can hear you're really going through a lot. You're facing a lot of difficult challenges at the moment.
Yeah.
Okay, so that was just a demonstration of one of the little video clips. Let me get back to the PowerPoint here. These are the listen actions. If you're not familiar with them, listen refers to how the helper introduces themselves, how they pay attention and listen actively, how they accept other people's feelings, how you calm someone in distress, ask about needs and concerns, and also how you help the person in distress find solutions to their immediate needs and problems. The special considerations for listen in the COVID-19 response, of course, is that we, for many people, are working through physical distancing and we're giving remote support. So that means we need clear verbal communication, and it also means that helpers are having to learn or practice remote supportive communication skills more, which is slightly different to if you were in face-to-face. And for example, also having to learn how to calm someone in distress over the phone. So for example, if someone panics while they call you, how do you calm them down? And there is in the training also guidance on how to how you can help someone who's having trouble breathing, how you can help them calm down and practice calm and controlled breathing. The last action principle, link, refers to helping the person in distress access information, connect with loved ones and social support, and tackle practical problems and access services and other help. And in a sense, link may be the most important part of psychological first aid, because for most situations, psychological first aid is the first step towards other help. And it's often a one-time interaction with someone who's in distress. And obviously, you're unable to help them solve all their problems, but you can help them be calm and cope with the problems they're facing immediately, and also therefore be able to find solutions to more longer-term problems, for example. Here are some examples of special considerations for link in the COVID response. One example is the importance of addressing rumors and false information, also helping people who are in isolation, knowing the national COVID-19 response protocol, and encouraging remote social interaction, for example, just a few examples. The training also focuses on what you need to do when you're preparing to provide support remotely, as this is also a little different to how you would usually do it face-to-face. So for example, check your environment where you're going to make your call from, make sure that your equipment works, that your telephone is charged, make sure you have contact details for the supervisor on hand, that you have psychoeducation materials to share with others, and referral information. One of the last activities in the training is for the participants to check their referral information, and if they don't have that information, then they have to make sure that they collect that before they go out and start practicing as PFA helpers. As I mentioned in the live training, participants can take part in role plays, where if, for example, you're using Zoom, they can do role plays in breakaway rooms, and the facilitator can sneak in and watch them doing their role play. But this obviously you can't do if you're only watching the recording. A very little introduction to the 4 additional modules. The first one on remote supportive communication focused particularly on teaching participants skills such as how to ask appropriate and relevant questions, since we have to rely more on questions than we used to, because we may not be able to see people. And as I mentioned, identify common and severe emotional reactions, knowing how to calm someone, and when and how to make referrals. So although the participants would have learned a little about this in the basic training, in this additional module, they get more of a practice and go in depth with these communication skills. In the caring for staff and volunteers, the participant is introduced to different ways that you can support staff and volunteers, either individually or in groups, and also introduced to different methods and systems that you can set up within your teams of staff and volunteers, such as peer support systems like buddy systems. The PFA for children focuses on, similar to the basic training, which is mainly looking at adults, but the one for children looks also at how children are impacted by COVID and how children react. And then particular focus, of course, is on how to communicate with children. And the last additional module on loss and grief that's the longest one of the 4 additional modules. It looks in detail at what the impact of loss is during this time, and not only the loss of loved ones, but also the loss of jobs, or the loss of your livelihood, or loss of social activities, etc. And then there is particular attention also to grief and how to support people who are experiencing grief. So in this example, you'll see There's focus on supporting the infected person's loved ones, or if someone has passed, how to ensure that they have safe and dignified burials or alternative mourning rituals if you're unable to do what you used to because of the COVID restrictions, faith-sensitive psychosocial support, practical support, and advocacy and collaboration. All of the trainings are also supplemented, of course, by reference to the latest information that participants can always find on the sites that you see here. But we also have at the Peers Center a number of podcasts and little audio recordings. There's, for example, an audio recording on how to calm someone. There's a role play where a woman calls a helper and she's panicking and really in a high state of distress, and you can hear how the helper calms her down and takes her through the process until the call ends. There's also an example of a short grounding activity. So we really invite you to go and have a look at all the different materials that are there. Right, I think that's about it. Thank you very much for your attention. All the illustrations that we've collected for the different materials are by a local artist here in Eswatini, and you can of course use them, or you could use illustrations that are from your own settings and contexts. Thank you very much. I think
so
back
much.
to Anouk.
Yeah, thank you so much, Pernille. I'm so glad that the technology worked out, which is also for online PFA always a hassle as well. So glad that you explained also how to do that when you don't have access to great internet, as that's as we all know, a very common problem in a lot of settings, including the African context. As Basilio is also saying in the chat, please feel free to post your questions in the chat, and they will be addressed during the Q&A session. As in the introduction, I said that we will start with an introduction to PFA by Pernille, which is finished, and we'll continue with an implementation of remote psychological first aid in the Kenyan Red Cross Society by Dorothy Anjuri for about 15 minutes. And then there will be a bit of an interactive session between Pernille and Dorothy to address challenges and techniques in remote psychological first aid. And then we'll continue with the interactive question and answers round, which will be facilitated by myself and Basilio. So please post any questions you may have during all of these presentations and discussions in the chat, and we'll address them in the last half hour. So if it's okay with you, Dorothy, could you present yourself, and is it possible for you to share your screen as well?
Okay, thank you very much, Anouk, for giving me this opportunity. My name is Dorothy Anjuri. I work with the Kenya Red Cross Society as a public health manager, but I'm currently coordinating the mental health and psychosocial support in the context of COVID. And I will request Basilio to share my screen so that I can be able to run you through the presentation. I think the next, Basilio.
I think you try slideshow so that it is clear.
Come again?
You put the presentation on slideshow. Yeah, she's trying to do that.
Yeah, sure.
Fine, thank you.
Yes, thank you. Yes, my outline will be a very quick introduction in terms of Kenya Red Cross core role in the implementation of the response of COVID, and a quick highlight on some of the key implementation activities, and then I will go straight to the PFA online training experience and some of our challenges that we have faced. Very quickly, without taking much of time, is that currently 38 out of 47 counties in the country have been affected by COVID, and cumulatively, as at today, we have 4,044 people confirmed cases of COVID. Those who have recovered are 1,353, and we have registered 107 deaths. Looking at the adults versus the children in terms of severe test symptoms, we are seeing that 5% of the adults present with severe symptoms as compared to 0.6% among children. The impact of COVID, of course, as we all know, has gone beyond health. It's now socioeconomic, and with a lot of other negative effects that has come with it. And this has also been compounded by a lot of fear and anxiety, especially within some of the activities that we are doing. We are getting a lot of people, of course, expressing a lot of fear, anxiety, then issues around loss of income, gender-based violence, and now we have restrictive movements, especially in the quarantine and in the isolation centers. And currently the country, of course, has been on lockdown for almost 8 days now. Yes, some of the things that we felt we needed to do is, of course, to reprogram and refocus some of the funds that we have so that they can be able to support some of the response, COVID response activities. And this, of course, has been done in consultation with our partners. Capacity building is also one of the key activities that we have been doing. And it's not only relating to mental health or the psychological fasting, but we are also doing a lot of COVID infection prevention control activities. But in our context, we have been targeting a lot of people in the different areas based on the high burden of COVID and also the effect that has come with. For the healthcare workers, as we all know, they are the biggest team that is at the front line and giving a lot of support. The young people initially were kind of forgotten, but now we have started refocusing on them, the prisons, the migrants, and of course the Kenya Red Cross staff and volunteers. We have a big network of MHPSS services in country, and therefore we have been rolling out a lot of trainings targeting the mental health service providers so that they can be able to offer counseling or PSS support or PFA support or psychological fasting support in their localized situations. Then we have also been doing a lot of caring for frontline volunteers and workers. For example, the healthcare workers, we have been focusing on psychological fasting sessions where we have counselors attached to the different health facilities, especially the high burden health facilities, so that they can be able to get day-to-day psychological support. And of course, our staff and volunteers who are also at the forefront in the COVID response, we organize a psychological fasting session so that at least we can be able to support them in terms of the day-to-day challenges that they are facing. Then generally, we are also targeting the general population. And this again, and I know in my next slide, I'll talk about the telecounseling that is being offered 24 hours by professional counselors. Basilio, you can go to the next slide. Who are able to, of course, provide them with the day-to-day support that is needed. So some of the key components, like I've mentioned, is the telecounseling services, which is 24 hours, and the toll-free line is 1199, which has now been marketed a lot even through the Ministry of Health, encouraging people across the country when they feel depressed, when they feel stressed, or they want to talk to someone, they can always call on this line. And we have been getting a lot of overwhelming calls, and a lot of support also has been given to the various people who have been calling. Then, like I mentioned, we have been doing psychological fasting sessions to our staff and volunteers, healthcare workers. We've also been conducting bi-weekly clinical supervision, especially for the counselors and the psychologists who have been reaching out to the frontline responders. Prison interventions have also been going on through therapy sessions. And then we've been conducting weekly webinars, again targeting the young people, and we've been coming up with different topics that would touch on their day-to-day challenges, and some tweaked more to the mental health issues. And this is done through webinars. And again, as I talk about the challenges, I'll be able to identify some of the challenges we are facing, and the mental health campaigns that have been going on. The next slide. Yes, switching gears now, let me quickly take you through the PFA online. I will not belabor a lot on what has been discussed about PFA, but just to emphasize that The Ministry of Health, the Mental Health Division, together with the partners who are in the mental health arena, they had to review the WHO and the PS Reference Center PFA manual so that then it could be contextualized to speak to the issues that the country is in terms of COVID and mental health. So therefore, when the manual was customized, then this is what was used by master trainers to now roll out the training across the country. Some of the target beneficiaries, as I've mentioned, we target the mental health the service providers, and these are actually targeting everyone, all the partners, the Ministry of Health, the Kenya Red Cross volunteers, because we have quite a number of professional counselors. So those are some of the key teams that we have been targeting. The healthcare workers, again, because it came out as a big need from the Ministry of Health that the healthcare workers need to be given some very basic skills on psychological first aid, so that even they can be able to manage themselves and even manage the patients that they are working with. We are also targeting the youth, the community health volunteers, the child protection actors, because the children again have they also have a unique way of expressing their issues, and with child protection actors being trained, it is adding a lot of value. And then we have our Kenya Red Cross staff and volunteers, some of the target groups. In terms of the methodology for the online psychological first aid training is first and foremost, of course, we identify the participants in collaboration with the Ministry of Health and the other partners. Why? Because we feel that we need to do targeted selection so that the teams that are trained then will be used or to support the rollout of mental health and psychosocial support services in their respective areas of jurisdiction. Then the other thing we normally tell them that is this training is online, therefore you need to find a conducive place or a space with a strong internet connectivity, because again, as I speak to my challenges, you see that we've been facing a lot of challenges around internet connectivity. Then again, the other strategy we've been using is that we were encouraging the teams to congregate in one central place, and then they get connected via Zoom with a projection connector, where the trainer, of course, will be seen through the video, through the video. So it has really worked. This has really worked very well for us, because even people who would not have access to internet bundles, then they can be able to come to a central place, and they, of course, through observing social distancing, then they can be able to participate in the training. Others have been able to connect individually, either from home, from their offices, or hotels. Hotels, again, why? Because there couldn't be people in the very, rural settings, but there couldn't be hotels within their vicinity where they can be able to go and sit and just be able to access connectivity. We've done quite a lot with many of the counties across the country. Then we've seen quite some remote counties in this country where participants are not able even to access, or be able to have internet connectivity in terms of the bundles. So sometimes we have been able to give them some facilitation around that so that they can be able to participate. So in terms of continuing the activities, then again, I think I'll not dwell so much on what is on the screen now, because I think somehow I have been able to touch on it because of time. Basilio, we can go to the next slide. Yes, where we are talking more about coordination. As I finish up with the challenges, yes, for us to be able to do not only the psychological first aid training, but all the other activities, there needs to be a very well coordinated way of working. So we have subcommittee members in place, where we have a membership of UN agencies, CSOs, and professional bodies. And I forgot to mention that Kenya Red Cross has been given a lead role to coordinate psychological support across the country, but this is done again in collaboration with the Ministry of Health and other partners. And we have been given a complementary role to sit in the National Task Force that is actually, giving the broader technical support in terms of COVID response. And for us, mental health subcommittee has been given airtime and space to be reporting on a weekly basis in terms of some of the interventions we are doing across the country. Then we have been also coordinating with other toll-free lines that focus on the children and on the gender-based violence, because we have seen a lot of increased cases of gender-based violence. So we have been doing a lot of cross-referral so that then the patient or the client is then given holistic support. And then again, targeting more on the youth interventions. And as I mentioned, the weekly webinars that have been very, very successful in terms of reaching out to the youth across the counties. Next. I think for the lessons learned is, of course, maximum engagement of participants is very, very key with lower level numbers of participants, so that you are able to give more focused attention. Then again, when training specialists such as the mental health practitioners, we have seen that the training should be more informed in terms of the day-to-day challenges that they are facing, so that you can be able to contextualize your training to speak to their needs. Otherwise, like for the healthcare workers, we felt that most of their needs was more about fear, more about death, more about losing their jobs, as a result of, a lot of things that are happening across the country. And then fear for their family. What happens if they die? Are they going to be compensated when they're in the line of duty? So that has been a very key lesson learned for us. And we have been able to continuously target their needs. Then in order to reach a larger group, there is need then to be always having more facilitators and ensure that we continuously adapt the materials in the different contexts and languages. Next. I think, Basilio, you missed on the challenges. Can you go back and you check the slide on the challenges? It's not that one.
1 second.
Yeah.
These ones?
Yes. I think the challenges that I'll quickly highlight is about, as we conduct the psychological first aid training, we have seen a lot of challenges, of course, with low internet connectivity. And therefore, you find a lot of participants are not able to get into the training. There's a lot of interruption, especially in case where there is electric power shortage. Then most of the participants actually are quite unfamiliar with the use of technology. And that's why I mentioned the issue of bringing them together and they're able to Zoom together. Then many people again join the Zoom. We have seen a lot of interest in terms of requests for PFA training. Therefore, the more people join, then it becomes a bit difficult even to control them within that one training. Then we having again to customize some of the to customize the training based on the different target participants, as I've just mentioned. And some of the key areas that we have been focusing on is how do we, target the healthcare workers based on the context that they are working in. And then again, some of the counselors that we have been, let me call them the mental health practitioners, because some are psychiatrists, psychologists, counselors, and all that. And we faced a bit of challenge in terms of some of them feeling that the content that we are presenting maybe is too simplified for them, and therefore maybe when they heard of the psychological first aid training, perhaps they expected something, very technical. But remember, the PFA is quite simplified because it targets the lay counselors. And then we have seen, of course, as you're doing the PFA training online, a few participants keep on exiting because, again, you're not there to physically be able to control them. And sometimes also some maybe their internet gets disconnected, and then they end up leaving the Zoom meeting, or some who have connected individually again end up just disconnecting and leaving, because sometimes you may not have a control on the same. So that quickly is what we had put together, and perhaps I will leave it there so that we can open it up for discussions. Thank you very much.
Thank you so much, Dorothy. That was very instructive to have a very practical perspective of how to actually implement online and remote psychological first aid. And just to highlight to all participants, so all the training materials are freely available on the PS Centre website, which we'll leave in the chat afterwards. It was also part of the PowerPoint presentation, pscentre.org, basically. And it's available in English, Spanish, Portuguese, and Arabic, and is currently being translated into French as well. So most of the African continent, obviously not the local languages, are available. So you can adapt it also to the local or national languages, and to your local setting, so to the context in which you're working. And this is free for you to do. You don't have to necessarily engage with us very strongly on this, but I do advise you to do so, because then we can help you how to best do that. So I'll also leave my contact details in the chats at the end, so or just now, so people can access some more technical support if they wish to adapt it to their context. Before we delve into that, I just wanted to check if, so Pernille is actually saying in the chat, sorry everyone, my internet is so unstable today, so we'll respond to questions by chat. So Pernille will be able to reply to any questions you may have by chat. Basilio, there have been a few questions. I think we saw especially one from Adelheid. Maybe you can present your question yourself, if that's possible for you to do so if you unmute yourself. The first question you asked in specific.
Okay, hi, thank you very much. That was very instructive. I had a question when Pernille, when you begin to speak with the person, you tell them that you have 15 minutes to listen to them. I wondered how that is taken, and especially in our region where generally we don't have a very good sense of limited time. And if somebody tells you, I have only 5 minutes or 15 minutes to listen to you, it tends to break, it gives you a break in, am I actually going to be able to say all that I want to say? How is it taken from your experience? Over.
Thank you. So Pernille is saying, also struggling to hear you, Adel, but I will respond as I read your question earlier. Okay, so she can actually read the written question that you said. So if I can respond in the meantime, I would say it's, yes, that's a challenge. We've also encountered the same issues on hotlines in, for instance, the Danish Red Cross, who had these hotlines as well. And Dorothy can maybe add to that perspective as well. That yes, this is a challenge. And this was also, especially on the hotlines, feedback from people hosting these call centers, that some people took really 1.5 hours of the time, whereas others just need a quick comment and feedback. Just to indicate the time gives a bit more possibilities to also say, can we call you back later? Is it possible for you to call me back later, if people really would need to have more time? And now Pernille is also saying, it is very useful to set a time period when you are in a position, when you are working. For example, on a hotline, this is where link is so important, to encourage the person in distress to contact social support if they need to talk a lot. It is different if it is a friend or someone you know. So that is the main feedback that Pernille is giving, that the function of psychological first aid is not to be someone's psychologist. And this is also not what we're training people for. It's really to use the active listening skills to refer a person to the support they most need, and also to encourage them to look for this support in their direct surroundings, because a lot of us have a lot of resilience within ourselves and within our communities. It's just that COVID and other challenges prevent us from accessing these resources, also because of stigma and a lot of other access issues. So it's also a means of encouraging people to reach out to their own psychosocial supports. And if people need practical assistance, that they get this practical assistance. And then if they need more specialized mental health support, which could also be the case if a person is really quite dark, is showing some suicidal tendencies, for instance, it's really important to link up with more specialized services straight away. Thank you so much, Adahed, for that question. Is that answering your question?
Yes, thank you very much.
Thank you. Dorothy, maybe you'll be able to speak to that as well. What has been the experiences of the Kenyan Red Cross in this regard, about the concept of time and indicating that you don't have a lot of time perhaps, so that's not maybe the function of the hotline to listen for hours. Can you say something to that?
Yeah, sure. And I want to concur with what Anouk you've said. Psychological first aid is basically, you know, the very first practical support that we're supposed to give to the person. And for us, what we have been seeing over time as the COVID, burden has continued increasing, we have seen actually people quite depressed. Some even they call, and before even you talk to them, they start breaking down. But what we have been doing is, again, to do a lot of referral, because remember, the toll-free line is open for everyone, and we cannot be able to have, you know, people cancelled via telephone for 40 minutes or 1 hour. It is not practical. So that is what we have been doing, that we have been referring them for further support. But then what the counselors do again, they call in again, like let's say like the following day or the day after, just to check on the client, whether they were able to be helped, and if not, then appropriate action is taken after that. Thank you.
Thank you, Dorothy. And could you maybe also, while you're responding, Miriam is asking a question that I think relates to this question. She's asking specifically for the Kenyan context, how is the coverage of psychological first aid? And do you follow up on the outcome? We still hear of MHPSS issues among health workers, their families, other community members, etc. And where do you link those needing more support beyond the PFA? Can you talk about the Kenyan context in this regard, Dorothy?
Thank you. I think for our context, what we normally do is, of course, once we do, okay, let me talk about the healthcare workers, for example. We have stationed in partnership with the Kenyatta National Hospital and the other hospitals that we are working with. We have stationed counselors who are able to sit in and support the healthcare workers. But in terms of their families, what we have been requesting them to do is, of course, to refer them to the 1199, which is the toll-free line. But again, for families who are quite in need, we have been able to have counselors actually reach out to them. For example, we have cases of children who have been kind of left behind by their parents because they have been taken to quarantine or isolation, or they're in the hospital because they are sick. So for some of those cases, then we step in very strongly, and we are able to support them. For other community members, we have, like I said, we have a strong partnership with various players who offer psychosocial support in this country. So we have already mapped out those partners in those counties, and we are able to link them to the specific counselors who have been identified in those counties. Some, they go to their homes, for example, but of course ensuring that they have their personal protection. Others, they do telephone counseling, just to allay the fears of what they are going through. And of course, again, ensuring that at least there are counselors on standby who are able to step in at any given point in time. I can say that this is not the county, so not everyone is covered 100%. As you can imagine, it's also a very expensive affair because the councillors are not offering these services for free. We have also to see together with our donors how we facilitate them. But the needs are more and more and more, and I can say it's not like we are reaching everyone, as it were.
Thank you, Dorothy. That's very useful to know. And I'd just like to add to what you were saying as well. Basilio, maybe you can give your perspective as well. And Pernille, if you're able to, in the chat. I was just thinking as well while you're speaking, that also it's good to know that a psychological first aid is really seen as a first approach, a first intervention, or not even an intervention. It's really a skill set that we would encourage everybody to learn. And you don't need a mental health or psychosocial support background to be able to apply the skills that you would learn in a psychological first aid training. It's actually strongly encouraged that anybody who does not have a mental health psychosocial background learns online PFA, such as we would also encourage everybody to learn first aid. Anybody can run into a car accident and may have to administer first aid at site when there's no doctor or nurse nearby. The same goes to encountering people in distress. We all encounter daily people in distress, not necessarily only humanitarian emergencies. And this is what we in the Red Cross are actually promoting, that everybody should learn psychological first aid. We want to, for instance, train all of our volunteers. So it also doesn't require per se a particular educational background. And that is because it is linking people to practical forms of help. So if people would need help afterwards, if they have been calmed down, if you're able to make sure that they're no longer in distress or less in distress, you cannot obviously always have the golden tool to help everybody to completely calm down. But you have a skill set to enable that you to do better. Most people would need practical support. They would need to be reconnected to their own psychosocial support network, which, especially now in COVID, a lot of people are especially stressed out about socioeconomic circumstances, and they were mostly interested perhaps in how to access financial forms of support or how to deal with the problematic situation they're facing, which is different for all of us. There's other training tools that we use in the Red Cross Red Crescent movement and in the global MHPSS community that would enable us to help people more. So to go beyond psychological first aid. If there is no psychologist or psychiatrist present, the doctors or nurses in the nearby surroundings have also not been trained on MHPSS interventions, because that would be another solution as well. We can also train other people, lay people basically, to do counseling skills. Problem Management Plus, for instance, is a new tool that has been developed by the WHO, which we're also currently testing to see if that would work for lay counseling purposes, to have people deal with their own problems and having short sessions to work through these problems. And I just wanted to touch base, Basilio, because you're following the chat. I saw Pernille posting a few comments. Would you be able to read those out loud for me?
Yeah, sure, I can do that. One of them is it's so super important to have referral information. Just like if you met someone who needed medical help, then you would know how to help them access this. So important to link. And the emphasis is on link. I think this is what she's trying to emphasize on. It's also very important to set up support for helpers, as it can be difficult and affect them personally to interact with others who are in distress.
Absolutely, absolutely. I think this is a very good message to our audience as well. Psychological first aid is not a golden tool. That's not how we're promoting it. It is a skill set that can help you, but we don't want to encourage people to think that they need to solve everybody's problems. That's not the purpose of psychological first aid. So we would always encourage people to do both psychological first aid training to all of their volunteers and staff, for instance, in an organization, but also caring for staff and volunteers at the same time, because it's so crucial that people who are helping others also get help and care themselves, and that this is supported by the organization. And we have freely available toolkits to that purpose as well. And there's also a few podcasts and webinars that you can listen to get more information about this in particular. So for healthcare workers that you may encounter in your work, but also the people that you're directly working with in a humanitarian organization, for instance. And I was just wondering, I see Rosalind was asking a question and Pernilla was responding to it. Basilia, it's difficult for me to follow the chat quite strongly. Could you maybe read Rosalinda's question, and then we can also give Pernilla's perspective to that.
For Rosalind, it was more of a note. She's saying, taking note of the implications that come into play during the COVID response, e.g. domestic violence, child abuse, partner violence, substance abuse, high levels of severe economic hardship. And Pernilla commented on that and said, in response to Rosalind's comment, the trainings are so easy to adapt, and you can add extra training on these specific problems if you feel that would be helpful.
Absolutely, and that's also why we're providing these additional modules, and we found the online PFA training to actually create more training needs, as you'll often see happening. When it comes to, for instance, sexual and gender-based violence, we also have a training to that purpose. So as Pernilla is saying, it's really use the online PFA training tool as a first step, I would say. If you are an organization that doesn't generally work in mental health psychosocial support, but is encountering a lot of beneficiaries or healthcare workers or community members or even government officials that are in great distress due to whatever humanitarian crisis or whatever life circumstance they're facing, psychological first aid is a first tool to use. So have it as a sort of skill set in your backpack, I would say, as you encounter your daily work, especially, and as well as caring for staff and volunteers. I would say that's just the basic setup. But obviously mental health psychosocial support, you can have entire standalone programs on it for which we can advise you as well. But we really wanted to target today's audience as well as a multi-sectoral audience. People who may not per se work in mental health and psychosocial support, but do encounter mental health and psychosocial support issues on a day-to-day basis, or who have staff and volunteers and community members who are telling them about these issues. Then we're saying online PFA could be a good start for you. And then see what's needed, see what pops up afterwards, because it doesn't mean that that's, as I said before, it's the golden tool for everything. It's just a very good start. And
maybe, Anouk, just to add one point on that.
Please do, yeah.
The tool is more of opening up on more huge issues. And by this, I mean, when you do PFA training, whether online or in person, but at least for now, we are talking of online, people tend to actually see the necessity of seeing a counselor if they need one, or seeking further help. And this is why the 3 action principles are very important. Some you may talk to and they get better instantly, but some may need further linking. And basing this to Dr. Miriam's question, sometimes you may see that some organizations have in-house counselors, but not so many staff go to see these counselors. But they end up calling the hotlines like what Dorothy presented. And they get better actually. And some actually see the need of seeking further help. So the tool is more of trying to emphasize the need of paying more attention of psychological assistance.
Yes, and there's different ways of doing that. In addition to what you're saying right now, PFA, we also have a group PFA module, for instance. So there's different ways of giving psychological first aid as well. I don't want to delve into group PFA right now, but I do want to highlight that, for instance, setting up a peer and buddy system within an organization is another way for people to access psychosocial support. Because being stressed and having mental health problems is a very normal thing to have in a humanitarian context. For both staff, volunteers, beneficiaries, community members, everybody deals with stress differently, and it is very normal to be distressed. But yet there is a lot of stigma surrounding it. So we need to assure that people have access to services. And before they access professional services, we need to encourage them to actually access their own psychosocial supports, which everybody has. I work, for instance, at the PS Center, and I have a team of people working around me. I'm also a migrant worker, I would say. In fancy terms, we call ourselves expats, but obviously I'm also just a migrant as anybody else. And I've worked in a lot of different humanitarian contexts, and I take those problems with me. It is good for me to know that I have colleagues who also deal with these issues. So before I go talk to a psychologist or a psychiatrist, which makes me feel that, oh, maybe there's something wrong with me, maybe I need specialized help, that doesn't mean that that's the case. I have talked to psychologists in the past because I thought it was a healthy thing to do. So I would encourage everybody to do so. But before you do so, try to see if in your surroundings there's somebody you can talk to, and encourage the staff and encourage the volunteers as well to access this. And one way of doing so is, yes, training people on online PFA, but there's more ways. So setting up peer and buddy systems within an organization is a very simple and effective tool. And what we, for instance, do in our trainings, we have, if we give a training at the PS Center, which we often do, on psychosocial support in emergencies, for instance, and we have used this particular tool also, for instance, in the Ebola context in Congo, so it would apply as well to what we're talking about right now, is to teach people, or to encourage people, I would rather say, to check in with each other before, during, and after their workday. Especially if people go out into challenging conditions, it's very good to encourage people to actually touch base amongst themselves and to make that a habit. Healthy habits are what helps us create our, to touch base with our own resilience, basically. So that would be something I would encourage. And Basilio, you obviously now working in both Sudan and Kenya at the same time, you are encouraging these issues yourself as well, especially with the Sudan Red Crescent that you're working with and the Kenyan Red Cross that you're working with. What has your experience been? Because you and me, we train people on caring for staff and volunteers in the Sudan Red Crescent, which is in a very challenging condition right now as well. What is your basic observations on using very simple tools for non-MHPSS trained people to allow for better mental health and psychosocial well-being within, for instance, a humanitarian organization or a community? What's your main thoughts?
I think I'll actually base my experience with that one slide that Dorothy shared on the kind of target you are basing your training to, or your participants. And you'll find that you may be training actually experts like you, Anouk. Maybe you're one of the participants, or you are a manager of a certain organization, or actually the top management of a certain organization, and you are pushing to train them on PFA. Why? Because sometimes organizations end up using a lot of resources in terms of MHPSS responses, but these people only need PFA, the basic intervention. So you end up arranging sessions with counselors, and there are more staff who need deeper assistance of counseling. And this is why, as a movement, both in Kenya and also in my experience in Sudan, we try to encourage people to do this. We encourage participants, or rather most community members, to participate in such trainings, because you end up spending a lot in doing actual counseling, yet you only need a basic PFA. And I can see Edna saying, any thoughts on how to adapt remote PFA for torture and war trauma survivors? Maybe Anouk, you can respond to that, then I can continue.
Yes, of course. I would be very interested also to hear from Pernille and Dorothy, their thoughts on this. But I would say remote psychological first aid. So that's a tool that you give in a remote setting. You're not face to face with somebody. So somebody may call you, or somebody may send you an app message, and they may disclose that they are a survivor of torture or war trauma. Then psychological first aid is still a good tool to use, because you're using active listening skills and trying to refer them and linking them to other services. And I would add to that the look, listen, link principles actually start with prepare. So you prepare yourself by making sure you have an overview of services that people can be linked to in their current context. So if you're in the Kenyan context, you would make sure that as you are answering a hotline, you actually have a list of phone numbers ready and a lot of resources ready that you can link people to. Specifically for torture and war trauma survivors, I would say, if you're already aware that they are torture and war trauma survivors, you already have contact with them, you are seeing these people regularly, there's other tools that you can use. Because psychological first aid is not an intervention. So we would never use it instead of psychological counseling, for instance, or other forms of, if people have severe post-traumatic stress disorder, they may actually need to talk to somebody with a clinical background, at least a doctor, a nurse, or a midwife who has been trained in the WHO manual MHGAP, for instance, where we teach people with a primary healthcare background to deal with people who have more severe psychiatric issues, who may need also medical support and psychosocial support. So that's one thing, to check if in your context people have been trained on MHGAP, or if there's actual psychologists and psychiatrists present. If not, there's always obviously group settings that people are encouraged to talk about. It depends really on the type of survivors and how you have encountered them, what your interaction has been with them, and what services are available. I can't answer that very shortly, but please reach out to us after this webinar so we can link you to appropriate services. And I also just want to add that there's been a lot of attention for trauma and torture, I would say, especially in humanitarian settings, rightfully so, because this is a very serious issue that needs to be we all need to deal with. I just want to highlight that the majority of people do not have a trauma because they're going through a traumatic event. So especially for the COVID-19 context, I would say there's a few people who would have PTSD, or post-traumatic stress disorder, as a result of COVID. The majority of people can be helped with way simpler forms of support than specialized psychological or psychiatric treatment, for instance. And even if people need psychological or psychiatric treatment, it doesn't mean they don't need more practical forms of help. They would still need an active listening ear from a friend, from their surroundings. They would still need financial support. They would still need a roof over their head and food to feed themselves. So don't overemphasize on psychological and psychiatric support, I would say, and really link with those services that are specialized in this. And if there's no such means, and there is a clear need, then there are other ways of doing that. And please reach out to the PS Center for support in this, if need be. And
just to add one comment from Pernille, which is
yes,
I think
please.
is also very important. As we also try to empower people to be psychological first aiders, we also need to have them supervised or supported, because some issues might be complex and they may end up carrying this forward, actually causing harm to them as psychological first aid providers.
Absolutely, that's a crucial point. Thank you for adding that, Pernille. It's not just caring for staff and volunteers, it's also assuring that people are appropriately supervised. And we have supportive supervision as a module added to the online PFA training, but that's the first start, I would say. There's also supportive supervision guidance, another document that you can find on our PS Center website, which could help you with that as well. And that would really allow you to support people in their daily work, not necessarily while they're executing online PFA, but it's crucial because people have a lot of questions. If they're answering hotlines, they hear a lot of problems from people that they may not feel adequate to deal with, and that puts a lot of pressure on them. So to assure that they are appropriately supervised and cared for, those two things at the same time is crucial. And I'm just wondering, as we are 6 minutes ahead of time, if our hosts would have any questions for us. Dr. Miriam, Marie, Tashana, were there any operational questions that you may have? Because you know this audience a lot better than we do, obviously.
I think if I may come in, and again, thank you very much for your interventions and the various presentations. I think for me, you've raised a very important issue on the fact that there's a lot of things which can be done at community-based level, and that we should, strengthen and remind the people that somehow they're even doing PFA when they're, by listening and, giving attention, so that they're not aware that they're doing it already. You highlighted the fact that we also need to fundraise for PFA, but more generally for MHPSS, if there's so much demand and also so much interest globally. The importance of knowing about the referral pathways and who would be able to support for more specialized services. So yeah, for me, I think you've covered a very, very important point. Ultimately, I think we also need to, it's a way for us to be more at ease with this topic and see how we can, how shall I say, demystify maybe also what PFA is and the scope of PFA within MHPSS. So these are my comments for now. Thank you very much again.
Absolutely. Thank you for that. And I think that's very, very useful. And I just want to highlight as well, there was a really good UNSG policy brief that came out on the issue of why MHPSS is such an important topic during the COVID-19 pandemic. And that I would say is a key policy and advocacy document that we can all use. And the Interagency Standing Committee on Mental Health and Psychosocial Support Reference Group. My colleague Sarah Harrison, she's the co-chair, as you know, Marie, of this group. She sits in our office together with WHO. Fami from WHO is the chair of this meeting. They gather all interagency, at interagency level, they gather all the agencies together and come together around these advocacy and policy issues during COVID-19. So there's been a lot of advocacy and policy efforts in that regard. And it's gaining a lot more momentum and attention, but yeah, obviously the socioeconomic crisis attached to this pandemic is preventing sometimes that funding is then allocated to these issues as well. And it's still seen as secondary and not life-saving. And that's especially something I would like to counter. It is definitely life-saving, especially if you're dealing with suicide, for instance. But also having this practical tool shows that it's not just trauma care that we should focus on, but accessing practical supports for people so they can help themselves. So they may actually be able to benefit from humanitarian aid better because of psychological first aid, from WASH, health, and all other services as well, not just as mental health. And Pernille is adding, the 4 additional modules will be available next week as they are very near finalization. At the moment, you can find the basic training, worksheet videos, and the recording of the full training on the PS Center website. So we are basically producing a resource per week, so please keep posted. And as Pernille had pointed out, on 3 main websites, I would say pscenter.org is to access our free materials, who.int, of course, for all the WHO materials, and mhpss.net for all interagency MHPSS materials, which have a wealth of resources developed in the current COVID-19 response as well.
I have a general question, observation.
Yes, please.
In the African setting, it has not been a very common issue for someone, especially people of the older age group, 30, 40 and above, to just call and say, oh, I need psychosocial support, or I need help. But if you reached out to them and you talk to them, then you would quickly notice that this is somebody that needs help, and maybe you'd convince them to link them to even more. So I was wondering whether there's room for calling the people, talking to them, and then getting to know their needs, and or do you have to wait for them to call you?
I would say,
wait for them to call us, it may not be much. The people who call will be just a smaller proportion of the community.
Absolutely.
That needs the service.
Yes, exactly. And I would say, first of all, mental health and psychosocial support, it has a stigma around the world. Every country I've been to, I've worked in the Americas, the Caribbean, Africa, in 18 different countries, Asia and Europe, and Eastern Europe, and Ukraine, for instance, as well, Middle East a little less. Everywhere I go, they said, but in our context, this is an issue. It is an issue in every single context. This is a global issue. We do not dare to talk about mental health, and there is no health without mental health. So it is at multiple levels that we need to start this discussion. We need to start at the top with this discussion, as well as the community-based level. We need to do it from both ends. So we need to advocate with our governments to talk about this. We need to use media to talk about mental health, psychosocial support. And first of all, we need to talk about it ourselves. I make it my point to also talk about my mental health and psychosocial support challenges with any staff I may supervise, for instance. I've been a country director of 660 staff in the Ebola response in Liberia, and I made sure that people knew it was okay to talk about these issues, because you need to set a strong signal and say, this is important, we need to talk about this. And just to answer your question very specifically, their hotlines are just one tool where people actively reach out to a service, say, I need help, I'm in great distress. The majority of people indeed will not call such a hotline, but we do encounter beneficiaries on a day-to-day basis in our community-based humanitarian work. If we are a WASH staff member, if we are a healthcare worker, if we are working in a shop, if we are fixing somebody's car, you will run into people who are in distress. And this is especially why it's so important to have everybody trained on online PFA, so they know how to deal with people in distress, how to offer a listening ear, and how to link them to services. And that's exactly the purpose of psychological first aid, that we can use it broadly for everybody, and that everybody can be trained on this. But yeah, it really can be mainstreamed, I would say. If we're talking about a humanitarian community-based setting, it can be mainstreamed throughout the organization. So when people are doing needs assessment, they can encounter beneficiaries and make sure that the beneficiaries that they encounter that are not just responding to their questions. It's not a matter of just engaging with the community and being accountable to them, but also being responsive to them and making sure their needs are met. So does that answer your question, Dr. Miriam?
Yes, yes, it does.
Anouk, I think I can also jump in and
please, yes,
agree with Dr. Miriam, what she's saying, that many people may not just call in because of the stigma around mental health. But I think in this COVID context, we have done a lot of media awareness campaigns, community awareness campaigns. And just a month ago, actually, when we did our analysis on the telecounseling, we saw over 69% of men and called in to request for whatever kind of support, whether it's about relationship, loss of jobs, and that kind of, also we were like, okay, it seems now that men are opening up, but I want to agree that we need to do more and more, especially at the community level, so that more people can be reached. But that's something I just wanted to highlight, that we are seeing the trend of men, seeking telecounseling increasing even more compared to the women.
Absolutely. And I would encourage also all our organizations to work with role models, especially also for the youth. They're very susceptible for having, for instance, social media celebrity of some kind speaking about their mental health issues. And making it a topic to be discussed, including men, including women, including children, including older adults, etc. And just want to add one last point, because I know we're running over time. Pernille is saying, here in Eswatini, Red Cross volunteers also know which homesteads have particularly vulnerable families. So they visit these homesteads specifically to provide support. So it's also reaching out to the vulnerable corners of the community and making sure that no person is left behind, basically. And maybe that's a perfect ending to this webinar, which I think has been very nice. I just, from my point of view, I really want to thank Pernille, Basilio, and Dorothy for being so kind to participate in this webinar, and Marie and Dr. Miriam and Tashana to ask us to present. That was very, very greatly received by the IFRC PS Center. Thank you.
Marie, last comments, please.
Thank you, Dr. Miriam, again, and to the IFRC team. I think for me, also looking at the background of the various participants, I'm sure we'll have a chance to have another, let's say, entry points on MHPSS through the various organizations. So I've taken good note of who attended. And yes, looking forward to having another session on MHPSS with technical working groups of WHO. Thanks again.
Okay, thank you, Marie. Any other comment from anybody? Participants in the meeting? Fine. Tatiana, any comment?
None from me. Thank you so much, colleagues.
Okay, are we going to get the presentations?
I have recorded on mine. I will be sure to share it.
Okay, please, thank you. All right, thank you very much. This was useful, and this is something that we all need. The link to the existing materials is there, and also we look forward to the new materials that are almost finished. Colleagues, you can build your capacity in this area, because we are always meeting people that need this kind of support. But I also noticed that what is very important is for us to also have contacts of where to link the people that may need more support than we can give. So if that might be something that we work on in the subgroup to help countries to compile those lists of reference places where people can be referred, so that they are available and accessible easily by different people. I think, Marie, that is something that the team can discuss how to take forward.
Absolutely, yeah.
So that I want to thank you so much, the facilitators, for the time you've taken to prepare for us and to come and be with us, and for sharing your knowledge and information. We thank you a lot, and I can see from the chat, many people are saying thank you. It was a very informative session. So with that, we would like to bring this meeting to a close, and thank you all for your participation. IFRC, we are grateful for that time. All right, thank you and have a good evening.
Thank you so
Thank you
much.
too.
Goodbye. Thank
Bye.
you.